Welcome to the Commercial Real Estate Show. Thanks for joining us to lead, learn, and laugh. I'm Michael Bull, your host to the world of commercial real estate. Well, today our show is about healthcare and healthcare real estate and real estate in general. You know, healthcare providers and commercial real estate participants are trying to understand and predict how demand, volume, and reimbursements will affect providers and the commercial real estate market. So today we'll start with a look at how Obamacare might affect providers and their use of commercial real estate. Then we'll get an inside look at the healthcare real estate investment market. Well, please welcome my guests, Rob Grossman and Ken Meyer, both principals with Deloitte. In the United States alone, Deloitte has 57,000 professionals providing audit, consulting, financial advisory, risk management, and tax services. Rob, Ken, thanks for joining us in Studio One today.
Thanks for having us.
Thank you.
Well, guys, we appreciate you being here, and I've seen your report on this subject, and it's incredible. And I hope you do another one now, but it's interesting how some things just haven't changed. We still don't know exactly what's going on, but looking forward to your insight on how Obamacare is going to affect real estate in general these days. And first of all, how many more people are going to have health care coverage, and what kind of demand is that going to start to have here?
So, Michael, we've seen several estimates with regard to the number of new insured, ranging from 25 to 35 million people. I think that there's been somewhat of a convergence around 30 million as a good number, a placeholder by 2016.
By 2016, and when does that start? Is it starting now? We are starting to see some of that, or is this delay in the website causing a delay in the newly insured?
Well, it should be starting as of January 1st, but this is all in real time.
Yeah.
And so, as we sit here today, it's impossible to predict how much of that will happen as of January 1st versus middle of the year versus the following year.
And that's part of the challenge in the industry, isn't it? Just realizing how fast this is going to happen and what's really going to happen. Well, what about the demographic of these newly insured? Where's that demand coming from? What part of the population?
Well, not surprisingly, it's largely the poor, although it is the working poor. I think most people
that sounds like me.
might assume that it's folks who are unemployed, and that's not the case. But it's people with jobs that don't provide health care insurance today. So a lot of service industry, specifically, where today those folks don't have insurance from their employer. And many opt not to get insurance either because it's prohibitively expensive or because they think it's not worth the benefits. The cost is too high.
What about the age range? What's the typical age range of the biggest increase in insured?
So 85% are above 18. Again, most are in the working demographic group. It's more going to be clustered in the urban areas. And again, where you might think of urban markets that have a higher percentage of working poor or poor people as a percent of the population in total.
Okay, so the major cities are going to see the biggest influx of new business.
Most likely.
Okay, and let's talk about how much more space is going to be needed. I mean, there's a lot of people interested in commercial real estate that listen to this show, Ken, and so how much more space are we going to need to take care of this demand?
The estimates that we've seen really are, looking at approximately 1.9 square feet for every new patient. So, doing the math, assuming there's, as Rob suggested, 30 million new patients or people on the healthcare rolls, we're looking at an additional demand of approximately 57 million additional square feet. I mean, not an insignificant number. As Rob pointed out, it's not spread across the country like peanut butter, but really focused in certain, probably the more densely populated areas and the areas where the populations that were just described generally reside.
But I do think that's a little bit optimistic because it's not as if the non-insured today don't receive any health care. And they do, and they go in for when they need, they go in for service. But the reality is we expect that they'll have more access to health care and they'll take advantage and choose more health care services down the road.
And I guess there's certain type of healthcare providers that are going to see a larger surge in business, right?
Well, yeah. I mean, we would expect. I mean, you look at the whole retailization of medicine, the expansion of the clinics along with the pharmacies and things like that. Those tend to be, the areas where we're expecting larger growth or increased demand of where real estate has been traditionally serving the healthcare industries. So I would suspect that when we look at from a real estate perspective, we'll see greater demand specifically on retail as an asset class that's serving medical than we've ever seen before.
Now let's talk about that a little bit. I mean, I think we do retail and we do medical healthcare, and the retailers that own these centers that are having some vacancy issues, they're really after these retail tenants and what's realistic, what type of healthcare providers really should be in these retail markets.
There's a definition too around healthcare and retail, and I say that because if I go back. The notion of a day spa to me is not healthcare. Yeah. That's a luxury service. But for folks who need physical rehabilitation and certain types of massage-like services, that would qualify as healthcare. And so there are services that somewhat straddle between healthcare and non-healthcare retail. And I stay with that for a second because think about how much has changed. Today the notion of a day spa is very acceptable. You have them at malls. Now go back 20 years ago, and if I said the word massage parlor, it would have a very different image and what you would think of. So again, there's been a fair amount of change.
Well, I'd like to have my insurance company know that I need a massage every day. I mean, I really need it. I think for health, it is healthy to be healthy. So I guess there is an argument that that preventive health care is important, and that's part of what Obama is trying to do here, right? Is get more preventative medicine out there.
Well, and actually, that's where the whole retail concept actually does sort of align. Mm-hmm. We see, for example, people have sort of argued over the years that retail is perhaps the most under-demolished asset class, and being able to repurpose retail real estate to serve the medical or healthcare community has some benefits: access to mass transit, access to roads, plenty of parking, all things that really do serve an expanding healthcare population. So whether we're talking about the expansion of a retail store adjacent to a pharmacy to provide an urgent care center, or converting a vacant store like the old Circuit City spaces or maybe some malls that are underperforming into full-blown healthcare or medical spaces, in addition to the more traditional medical office space that we're all familiar with.
Right. Well, I think it's more pleasant for me as a consumer if I'm going to go to see a doctor or to get some minor medical thing, and if I'm going to a mall and I can buy my iPad next door and then walk in. I'm not going to a hospital with a lot of sick people around. So in some cases, it's a pleasant experience for the consumer, isn't it?
I do believe it is. I mean, you walk the fine line of fearing that you're going to fill your mall with a bunch of sick people, but there's a lot of services that are being provided to not a true sick population, where the retail access really provides a great opportunity.
Right. And the reality too is a big thesis behind the legislation is that the increase in preventative care services will reduce the amount of catastrophic service that's needed down the road. And so again, it's a question of, and that's the big bet. By having more preventative care, people will have less chronic issues down the road.
Yeah. And then when you look at the healthcare systems, it's also marketing and advertising. It really gets their name out there and maybe helps their business pull in from these retail centers, right? It's almost like advertising for them.
Well, it certainly is, and it becomes another draw. How are we going to bring additional shoppers or additional consumers to the center? And this certainly provides a new avenue and access to additional folks who might not have otherwise gone.
All right, so you've got a big number here of the possibly that we may need of office space or commercial real estate for medical uses. What are construction levels for true medical office buildings? It seems like we haven't had very much new construction of anything for several years. What do you see there?
Well, it's interesting because, after the credit crisis, when things really slowed down, we really didn't see very much new construction for several years. But things are trending up. I mean, we're looking at, let's see, from a medical office space perspective, in 2013, we've seen, according to some of the brokerage reports, 10.3 million square feet medical office space being constructed this year alone. And overall, construction starts in healthcare are projected to be 68 million square feet in 2014.
Okay, so we're going to see more development here. It seems like we talk to our clients; they're not really building any spec, and they really want to have tenants in these buildings before they build them. So it'd be interesting to see what happens with supply and demand and rents, and we're going to get a little bit more of that. So stay tuned. We'll have more on Obamacare and how it's affecting the real estate market. I'm Michael Bull. This is the Commercial Real Estate Show. We'll be right back. The Commercial Real Estate Show is brought to you in part by your friends at Bull Realty. When your business requires proven performance, visit bullrealty.com or call 800-408-BULL. Welcome back. I'm Michael Bull, and this is the Commercial Real Estate Show. If you'd like to know the absolute latest on any commercial real estate related topics, check out our on-demand show podcast. For example, last week we covered social media strategies that work. There are lots of interesting shows to choose from. Just grab your phone, tablet, or computer and visit iTunes or the show website, commercialrealestateshow.com. Today we're discussing Obamacare, the healthcare industry, and commercial real estate. My guests are Rob Grossman and Ken Meyer, both with principals with Deloitte. And guys, we talked about the increased demand. And Ken, you cover real estate. What's this demand going to do to office building or medical office building rents and values?
Wow, big question and a lot of different answers there. In the right markets with the right space, it's very positive. I mean, Rob talked a little while ago about demand not being equal around the country, but really the opportunity to be, to grow the most in the urban areas where we're going to see the greatest increase in population being served by healthcare. So we would expect demand to be greater. That supports, the increase in rents. But it's also even not that simple, because it really needs to be aligned with probably, for example, medical office space being aligned or closely approximate to the centers that are going to thrive. So all hospitals, for example, are not going to continue to exist as they have in the past. So the stronger hospitals, the ones that are growing in the market and really thriving within that space, are likely going to drive the medical office demand around them. So the right market, along with the strongest hospitals, are likely to see high demand, which translates to high rents.
But I'll say to that too, again, we expect that there'll be consolidation in the industry, because the requirements, the regulations really are going to necessitate having capital. And so as there is consolidation, and by the way, efficiency, right? Again, it's called the Affordable Care Act, so the intent is to have more efficiency. And so we would expect that there'll be some consolidation, and so there will be growth needed in certain places, but there'll actually be reductions in others.
Yeah, I hope it's affordable, right? That's what everybody's hoping. Well, what about demand for non-medical office? What do you see there? What do you expect? I mean, you've got the billing, the back office. You've got a lot of other uses that are related to healthcare that maybe they'll take out of these more expensive buildings. Do you see more demand for non-medical office?
There will definitely be additional work and additional people required to support the Affordable Care Act. So whether it's processing claims for people who previously didn't have insurance and what have you. Mm-hmm. What remains to be seen, so we don't really know yet how that's going to be delivered. How much, for example, of that claims processing work is going to take place offshore. And that obviously has no impact on growing the demand for jobs or space to put workers in the U.S. So I'm certain that there will be more paperwork associated and people who will need to process it, but I am not sure where that work is going to be provided. Rob, is there anything you'd want to add on that?
No, again, that's it's a good question, and arguably some of the same elements Ken just talked about are we'd be having the same conversation with if not for the new legislation, and that's just a function around progress that's being made in how to get our arms around all of the bureaucracy that surrounds healthcare. Again, one of the intents is to streamline, promote efficiency, and that would suggest that we would like to get to a place where there's less of the back office work needed. But again, as we sit here today, I don't know if that's something that's going to be realistic in the next 12 to 24 months.
Right. Okay. So there's a potential of demand increasing pretty quickly. So do you think we'll see non-medical office buildings, regular office buildings being converted to medical?
Depends where.
Yeah.
There are certain places where it makes absolute sense. So if you kind of take the conversation we've had thus far and you'd say, well, if there's a hospital center in an urban market that's going to now start receiving a lot of reimbursement that it hadn't received before, and that hospital is, one of the quote long-term winners. That's going to be a survivor. So the consolidator, as opposed to the consolidated, that would be a great place where you might want to see real estate expansion, and so nearby buildings would probably be very valuable for the medical space.
It really depends on the kind of work that's being performed. I mean, traditional medical-related office activities translate nicely into non-medical office buildings, but some more sophisticated outpatient services really do require more purpose-built buildings, which will either require heavy modification, redevelopment, or may not compete favorably to new construction.
Okay. What about for our listeners that are invested in REITs that own office buildings, or they own or manage regular office buildings? And, I think some of the tenants that we talk to and interview because of Obamacare are a little bit uncertain about the future and maybe holding back some hiring and some growth. How do you think Obamacare is going to affect job growth?
That's a third rail kind of question, and it really depends upon which side of the political spectrum you happen to sit on. We don't take a political stance on that, and so it really depends upon the thesis of how the legislation works. Again, as the legislation has really just started to take hold, it's too early to tell. But that is a question that is certainly has a polarized and spirited debate that we see in talking to clients.
Okay. Well, what other changes might we see that can impact commercial real estate with Obamacare?
Well, I'd say the advances in technology in general, Obamacare or not, are going to change the way healthcare is delivered. So, for example, we're seeing more outpatient services being delivered, because the technology is more readily available and because there's a drive for efficiency, with or without the Affordable Care Act. We're seeing a rise in telemedicine, where folks don't necessarily even need to go visit a doctor in order to get some sort of medical advice that previously was not a usual venue for communicating with a doctor. So these are all changes that have yet to play out. I can't say specifically what the outcome will be, but logically I can connect the dots and suggest that these kinds of changes certainly affect how space is used to deliver medicine. You could look at just your general, how you use medicine today. A decade ago, you would never have gone to your pharmacy for a flu shot. But now, that's almost the norm. And that represents a significant change, an increase in space that's demanded for the pharmacies, and a decrease in the number of patients that are going for shots at their primary care physicians. So that represents a shift in the delivery of care. And I don't know that I'd necessarily attribute it specifically to the Affordable Care Act, but it definitely translates to how space affects how medicine is affecting the use of space.
And are you seeing this growth for retailers, if you will, getting involved in healthcare continue to increase?
Absolutely. Retail, the last few years, you've seen it certainly in the pharmacy space. That's one example. I think you've seen it in some of the other spaces where there's an healthcare play. Again, years ago, if you went to the mall to get a pair of eyeglasses, you had your prescription and you were going for the glasses. Increasingly now, you can go get your prescription at that place because they'll have an optician on staff, and so you're seeing much more of a combination of the service with the product.
Right. Okay. Well, what are some other real estate opportunities related to the changing healthcare environment?
Well, we spent a lot of time talking about the affordable care side of the Affordable Care Act, but there's the whole concierge medicine side that I think has introduces another element of demand. So at the other end of the spectrum, we do see higher end levels of service being made available to those who are privately paying. And while that service is generally going to be also aligned or closely to hospitals and other providers, there still is that's a different kind of service, different kind of customer, and that creates a demand for in higher end spaces in different kinds of neighborhoods.
Well said, Rod. Ken, thanks for joining us today, guys. We appreciate it.
Thank you.
Thank you.
Well, next we'll get an inside look at healthcare real estate investment market. I'm Michael Bull. This is the Commercial Real Estate Show. We'll be right back. The Commercial Real Estate Show is brought to you by your friends at Bull Realty, France Media, Atlanta Office Liquidators, and Wiseman, Nowak, Curry, and Wilco. For more information about these companies or to access additional show podcasts, videos, or blogs, visit commercialrealestateshow.com.